Colon cancer may be silent, but it speaks volumes if you know what to listen for. In the shadows of our awareness, colon cancer lurks as one of the top assailants in the realm of cancer-related fatalities worldwide. This disease stealthily progresses, often without causing noticeable symptoms in its early stages, making it a particularly treacherous foe. The gravity of colon cancer is underlined by its capacity to disrupt lives, yet, with timely detection, many of these effects can be mitigated or even prevented. Understanding and recognizing the early warning signs are akin to having the right keys to unlock a door before it becomes impenetrable. It's not just about finding a disease. It's about reclaiming the narrative of one's health. Early detection stands as a beacon of hope, significantly increasing the chances of successful treatment and survival. Every moment counts, and each sign or symptom could be crucial. Stay tuned as we unveil the signs that should never go ignored. Ever noticed a sudden shift in your bathroom habits? It's time to pay attention. Persistent changes in bowel habits can be subtle yet significant indicators that something might be amiss. Whether it's constipation that won't go away or diarrhea that interrupts daily life, these symptoms can be more than just inconvenient. They might be signs of colon cancer. Dr. Emily Thompson, a seasoned gastroenterologist, explains that changes in bowel habits occur when a tumor in the colon alters the functioning of the intestinal tract. This can lead to blockages or changes in the consistency and frequency of stool. It's crucial to understand that these disruptions are not just about discomfort. They could represent changes in the cellular activities in your colon, possibly pointing to malignancy. It's a common misconception that occasional bowel irregularities are normal. However, when the pattern persists or changes dramatically, it's essential to consult a healthcare provider. They can help determine if these changes are benign or symptomatic of something more serious. Remember, consistency is key, not just in routine, but in what's routine for you. A red flag in the bathroom could be more serious than you think. When it comes to colon health, one of the most glaring yet often overlooked symptoms is the presence of blood in the stool. This can appear as a bright red color on the toilet paper, or a darker, almost black color within the stool itself. Blood in the stool, whether visible to the naked eye or hidden, known medically as occult blood, is a potential sign of colon cancer. While it might be easy to brush off occasional bleeding as just a harmless issue like hemorrhoids, it's crucial to take this symptom seriously. Colon cancer often develops without pain or noticeable symptoms, making it a silent threat that lurks undetected. The detection of blood, especially if it occurs repeatedly, should prompt an immediate consultation with a healthcare provider. They may recommend tests such as a colonoscopy to investigate further. Remember, early detection plays a pivotal role in effectively treating colon cancer. Never overlook a warning, even if it seems minor. Losing pounds without trying might not be the win you think it is. In the journey of life, sudden weight loss can be a silent alarm, especially when it comes without a change in diet or exercise routine. Imagine stepping onto the scale and noticing that you're several pounds lighter. It might initially bring a smile to your face, but the underlying cause could be more sinister than you think. Dr. Emily Thompson, an oncologist, explains that cancer, including colon cancer, often leads to unexplained weight loss. This occurs because cancer cells consume a large amount of the body's energy. Additionally, they release substances that alter the way the body processes food and nutrients, leading to weight loss even if your eating habits haven't changed. This kind of weight loss is not due to fat loss, but rather a loss of both fat and muscle mass, which is why it's important not to cheer these unexpected pounds dropping. It's a sign that something might be amiss internally. If the scales tip without reason, it's time to check the cause. Feeling endlessly drained? Your body might be signaling for help. Fatigue can often be brushed off as a simple side effect of a busy lifestyle. But when the tiredness becomes chronic and severe, refusing to dissipate after ample rest, it could be an ominous whisper from within. One such whisper could be from colon cancer, a condition that stealthily undermines your energy levels. Now you might wonder how colon cancer ties into feeling fatigued. The connection often lies with anemia, a common sidekick of this cancer. Anemia in colon cancer patients typically results from chronic blood loss that might not be visibly apparent. This loss of blood gradually depletes the oxygen-carrying capacity of your blood, leading to relentless fatigue. This type of fatigue is profound, not relieved by sleep or rest, and can significantly impair daily functioning. It's a fatigue that feels as if every ounce of your energy has been siphoned off, leaving you perpetually exhausted. Don't dismiss constant fatigue as just another busy week. A persistent pain in your gut shouldn't be ignored. When it comes to the complexities of our body, the abdomen is a hub of activity, not to mention a common site for various discomforts, including those associated with colon cancer. Among these unsettling sensations are persistent abdominal pain, bloating, and a general feeling of discomfort. These symptoms may seem common, perhaps even dismissible as a bad meal or a minor stomach upset. However, in the context of colon cancer, they are anything but trivial. From a medical standpoint, these symptoms occur because as a tumor grows, it can obstruct and exert pressure on surrounding tissues and organs. This pressure not only causes pain, but can also lead to bloating and a persistent feeling of fullness. The reason behind this isn't just the physical presence of the tumor. It's also about how the tumor interacts with the nerve endings in the abdominal cavity. If you're experiencing these symptoms consistently, it's crucial to not brush them aside. Consulting a healthcare professional can provide clarity and ensure that if it is something serious like colon cancer, it's caught early. Listen to what your body is trying to tell you. Noticing changes in the appearance of your stool? It's more important than you might think. When it comes to colon health, one warning sign to be vigilant about is the change in the shape or caliber of your stools, particularly if they become narrower than usual. Imagine the inside of your colon as a tunnel. Normally, stools pass through with relative ease, maintaining a certain thickness. However, if a tumor starts to grow within this tunnel, it can constrict the path, forcing the stools to adapt by becoming thinner. This transformation is not just unusual, it's a signal your body might be sending about a blockage or growth in the colon. This change can be gradual, and it's easy to overlook. However, consistent or significant narrowing of stools is a symptom that warrants attention and further investigation. It's a tangible sign that something might be impeding the natural pathway of your digestive tract. Keep an eye on changes, no matter how small they seem. Feeling weak? It might be more than just a lack of vitamins. When we talk about iron deficiency, most would quickly imagine a diet low in iron-rich foods. However, there's a hidden facet to this condition that might not be as obvious. Iron deficiency anemia can be a subtle yet significant sign of colon cancer. This type of anemia often stems from chronic hidden blood loss, which, surprisingly, may not always be visible to the naked eye. As iron plays a crucial role in producing hemoglobin, the substance in red blood cells that carries oxygen throughout your body, an insufficient supply can lead to fatigue and weakness. But where does colon cancer come into play? Well, tumors in the colon can slowly bleed, and this blood loss, though minimal and often unnoticed, gradually depletes the body's iron reserves, leading to anemia. It's vital to consider that if you or someone you know is experiencing iron deficiency without a clear dietary cause, it should not be brushed aside. A medical consultation could be crucial. Sometimes, the clues to your health are hidden in plain sight. Think twice before brushing off these symptoms. In the journey of life, it's easy to overlook subtle changes in our health, especially when they seem inconsequential or intermittent. However, when it comes to colon cancer, what might appear as minor can actually be a signal of something much more serious. Throughout this discussion, we've touched on various symptoms, from changes in bowel habits to unexplained weight loss and even the presence of blood in the stool. Each of these signs, while possibly benign on their own, could indicate the presence of colon cancer. Ignoring these symptoms might seem like the path of least resistance, but doing so could delay crucial early detection. Colon cancer is highly treatable when caught early, and the best way to catch it is by paying attention to your body's signals. So, if you notice any persistent changes or symptoms that just don't feel right, don't hesitate. Reach out to a healthcare professional. Discuss your concerns and get the appropriate screenings. Taking action early could be your best defense. Awareness is your first line of defense against colon cancer. In the past few minutes, we've navigated through the crucial warning signs of colon cancer, a condition that remains stealthy yet significantly impactful. From unexpected changes in bowel habits and the alarming sight of blood in your stool, to unexplained weight loss and persistent fatigue, each sign is a beacon, urging for attention. We discussed the discomfort of abdominal pains and the subtler cues like changes in the appearance of your stool. Not to overlook, we highlighted how an iron deficiency might be more than a dietary flaw, but a whisper of something more grave lurking beneath. It's imperative to listen to your body and recognize these warnings. If you or someone you know is experiencing any of these symptoms, it's crucial to take action. Consult a healthcare provider to discuss your concerns. Early detection not only opens up more effective treatment options but also significantly increases the chances of a successful outcome. Remember, knowing is half the battle. Stay informed, stay healthy.